Welcome to the Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, the Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper, Dr. Robert Graper, and Dr. Evan Zug, also known as the Doc Dudes.
Welcome to yet another The Doc Dudes. This is episode 12. Wow, the name of this is Your Time to Shine. When is the right time for plastic surgery? Because, man, we get asked this all the time. All the time. I got asked today in a consultation. I got asked, you don't really do plastic surgery in the summer, do you, ever? And I was like, yeah, of course. I mean, certain people, it's just the stars are going to line up to where that's the time. But there's not like a time of year that we say, here's when you need to do plastic surgery. We'll get into kind of the intricacies of each individual kind of plastic surgery that we do and procedure and let people know maybe when it would be best. I don't think you want to necessarily walk around with a full body compression garment in the middle of August in Charlotte. But, you know, if you're a school teacher, you're probably getting it done during the summer, you know? So I am Garrett Harper along with
Robert Graper
and
Evan Zug.
All right. And we are the three Doc Dudes here at Graper Harper Cosmetic Surgery. Again, we're going to talk about why it's important to kind of find the right time. And some of that's philosophical, right? Like, I mean, you can really get into the nitty gritty about where someone is in their life, right? I mean, if they're going to have kids, if they're got a youngster that clings to them and won't let them heal right, if they don't have a good support network at home right now, if they're going through things in their lives, all those things.
Medical problems.
Correct.
If
all
they're
those things.
overweight, if they're a smoker.
Right. So
those are the things I think of. Sorry to interrupt, but yeah, those are the things I think of when I think of this question. It's not like, when's a good time? Yeah, it's very important to have a support system and, you know, a good time in your life where you can recover.
Right.
But that's all variable.
And doing things to optimize. It's like somebody comes in that says, I don't do any skincare. I'm 65 years old. I hate my neckline and my jowls. I'd like to do a facelift tomorrow. What are you going to say to that person? I know that you send these people to our estheticians to get like their skincare and the health of their skin optimized as much as possible prior to surgery, right? Like we all know the old adages of, not smoking cigarettes, not being on any nicotine products. So, you know, if you stop smoking cigarettes, it doesn't mean you can jump to vaping or like, you know.
Well, tell them why why do we want people to stop smoking?
Yeah, it affects wound healing. It can lead to disastrous problems if you don't have those little blood vessels that are sending nutrients and things that you need to heal these big incisions and these things that we do. And I mean, I do not operate on a patient if they're using nicotine in any form at all.
Right.
If they're around a lot of secondhand smoke, I don't.
Right.
So I would say
super
that
important.
Anything that is an undermining procedure, facelift, neck lift,
Sure.
mastopexy, breast reduction, tummy tuck, the answer would be you got to quit smoking. If you're doing your eyelids, it doesn't matter. If you're doing your nose, it's not enough undermining. Blood supply is so good. Brow lifts are okay. Liposuction would be okay, wouldn't it? What do y'all think about liposuction?
I mean, I just worry about oxygen delivery. I worry about, because fat necrosis can really happen anywhere, especially if you're doing liposuctioning to patients. And, part of the reason why when we talk about cigarette smoking is the coughing after surgery too.
Mm-hmm.
Yeah.
Sure.
And that the kind of coughing can lead to blood vessels getting higher pressure behind them, and then all of a sudden you got bleeding and issues and stuff like that. So we've been given a list of a bunch of different questions. Obviously, these have kind of come in from other patients, or Debbie, who's in charge of these podcasts, has kind of come up with this list. So I'm just going to go through them, and I'll play moderator, and we'll just go kind of back and forth between Dr. Graper and Dr. Zug, and any interjections that we need to make, we will. So, Dr. Graper, should I have plastic surgery as soon as an area on my face or body bothers me. Like as soon as it bothers
Like if you had
me.
hairy cheeks?
Maybe. Yeah, exactly. And that was from podcast number 11. Yeah, you were listening.
Like,
you were listening.
It's like one of those
Yeah,
comedy
yeah,
people.
yeah.
They bring jokes back
Yeah,
from the front and the back.
So if they're listening to this podcast, they have to go back and listen to 11.
Right, which is a good one.
It was a good one. Yeah.
So if something bothers you on your face, it has to be a real problem.
Yeah.
It has to have a real solution. It has to actually
You mean like
bother
by
you.
real, you mean definable.
Yeah, I mean, like if you say, I don't like my nose, and by everyone's standards, your nose is gorgeous, well, I don't think you're going to want to have your nose changed.
Right.
But if you have a big bump on your nose, a big convex dorsum, and it hadn't bothered you, but for whatever reason, it all of a sudden bothers you, it's a reasonable thing to start doing due diligence about what it would look like, what's involved, what's the cost, what's the recovery, what are the complications. Do some due diligence. And after that, if you still think this bothers me and you think that the operation is safe and effective and affordable and private and your health is good, then if it checks all those boxes, it's a reasonable thing to do, whether it's a rhinoplasty or liposuction or breast aug or whatever. But if it doesn't hit one box, it's questionable. If it doesn't hit two boxes, I probably wouldn't do it.
I feel like one of the underlying principles of this question is, do I go ahead and pull the trigger when something's bothering me, or do I wait till I just can't stand it anymore? You know what I mean? Like, how many patients do you get, Evan, that come in that are like, I'm so happy I did my breast lift or my tummy tuck or my breast reduction. I wish I'd done it 10 years ago. And you're like, oh, man, you've been running around the last 10 years.
Could have been better.
Not happy with yourself. Yeah. And also, we age, right? So in Dr. Graper's corner from a facelift, and Evan, you can kind of talk from a breast and body standpoint and what your what you have found your patients' thought process to be. But a lot of people say like you're going to get a better result if you do your facelift earlier. Which I understand what they mean by that, and
Well, there are two things there.
Right.
One is the tissues are better, so the results are better because they're just stronger and tougher and thicker and they look better. Plus, they last longer.
Now, here's the caveat to that.
Plus, you get to enjoy it.
I agree. But here's the caveat to that. Like, what we mean is we're all aging. So, sorry, folks, if you're listening, you are aging. Now, we can do everything in our power to try to slow that down. You can't really reverse aging. That's kind of a quirky way to say it. But we are all getting older, but that doesn't mean that we can't get better and improve where we are. I mean, the perfect example is somebody who doesn't take care of their skin, and then all of a sudden starts taking care of their skin. There's no reason you can't have better skin 5 years from now than you do right now.
Chronologically, you're getting older, but
Correct.
Physiologically, you can improve.
That's a great way to put it. So, Evan, are you seeing that when, there's just nothing that just kind of, oh man, I wish they had done it earlier.
Every single breast reduction I've done this year, they say, man, I wish I would have done this earlier.
Yeah.
And they're just so happy. And
it's one of the most gratifying
surgeries.
so
rewarding to me is it totally changes their life. I mean, they're so happy.
Yeah.
They end up losing weight and working out, being healthier.
Right.
They're just so much more confident, and they just wish they had done it so much earlier.
Yeah. I love that. All right. Well, what are some factors to consider, to tell patients to consider before deciding on surgery? And so I talked a little bit about it before. I mean, one is there's no doubt that post-surgically you need a support network, right? And so for a lot of, because I operate on a lot of moms. I mean, that's just kind of, I do a ton of mommy makeover, a ton of breast and body. Dr. Graper does the lion's share of face and nasal surgery here at the office. But, I'm kind of consistently telling folks, one thing you have to think about is I had this 2 days ago in consultation. Patient said, well, how do you, tell me about your tummy tucks. I told her about, muscle separation. I personally do several rows of absorbable barb sutures to bring their muscles back together. And then I do kind of a belt and suspenders. I use a permanent stitch, an Ethibond stitch, and a figure of 8 that goes straight down the middle of their abdominal muscles to kind of hold it there. And she said, well, what if I'm not exactly 100% sure that I don't want to have kids. And I said, well, I wouldn't do the Ethibond. And you probably could. There's plenty of people who've had tummy tucks who have gotten pregnant after it. But I just think from a standpoint of being safe and just kind of thinking things through, I tell those patients, you don't know if you're going to get pregnant. You don't know if you're going to have another kid or if you can even do that. So get your surgery now so you can enjoy it. I mean, who knows? If you get pregnant in 5 years, we'll cross that bridge when we come to it. But that's one element. Where are you in your life cycle? Where are you done having kids?
That really plays into breast reductions.
Yes.
For the young girl.
Yeah, for the breast, we know there's a certain population of patients who can breastfeed and who cannot breastfeed.
Yeah, 50%
before surgery.
50%
right?
can't. Yep.
So we've studied this and we've shown that, well, it may affect breastfeeding, it may not.
Right.
We don't really have the direct answer.
Right. And I think
a lot of patients breastfeed after having a breast reduction.
Yeah, and I think statistically what it shows is that there's actually no difference when you go to kind of what percentage of patients successfully breastfeed, because less than 50% of women can do that. But people say, I'm going to get my breast reduction. Will they change if I get pregnant? And it's kind of what like Dr. Graper's alluding to. It's like, yeah, I mean, they can. I mean,
their breast change whether you have surgery or don't have surgery with pregnancy.
That's right. And so, but I feel like people are waiting for this kind of, I'm through with everything, and now we'll address
so many patients are afraid of that and just want to wait till they're done having kids. Or, I mean, I just see from all the patients that we all see how happy they are that they've done it. So why would you wait?
Right. 5, 10 years. I mean, it's 5 or 10 years that you.
There are reasons to wait.
Right.
To have surgery.
Right. And then
but
some of those people don't
really
end up.
To me.
Yeah. Some of those people don't end up, having any more children either. So, it's always different. Now, what about weight? What about if somebody comes to you and says, this is the heaviest I've ever been, but I really want surgery now. I think it'll be a good kind of kickstart to things. What do you tell that patient? They're 40 pounds heavier than that.
I tell them that good candidates, good results, and everybody else gets something less. Yeah. And the price is the same whether you're a good candidate or a bad candidate. So why wouldn't you wait to be a good candidate?
Right.
So, in the past, weight loss has been very common in America that everybody needs to lose some weight, including me. But to make yourself a better candidate and spend the same amount of money, it's really important, and it's been very difficult to do. And how many did we send away and say, come back to us in 6 months and 50 pounds? And, it was a very small number. Right. But now with these GLP-1s, the semaglutides, it is, in my mind, very exciting that now you can give somebody a concrete, and it's just not willpower and stamina.
Right.
Take a pill or a shot, and it, I don't know what percentage of lose weight, but I think it's 95 plus.
Yeah, it's phenomenal.
And we've, you two have taken care of people that have lost 100 pounds, 200 pounds. Mm-hmm. I mean, that's amazing. And then they become great candidates, and their life has changed forever. Right. And I just think that's a huge advance in the last 2 years.
Yeah. I also tell patients, we could devise a surgical plan right now for you, but if you lose some of the weight on your own, A, that can change, and B, it may save you a ton of money. You may not need all the surgery that we're talking about right now.
Well, on the other side of that is, let's say you just do the surgery because you're impatient, you do it, and then all of a sudden you discover the semaglutides, and now you lose 40 pounds.
Oh,
well, now the surgery's not, you kind of come back and tighten things up.
That's right.
So for a lot of reasons, you ought to get where you're going to be before you do surgery.
Yeah, so I think this kind of sheds light on, because every patient has their own kind of journey, right? So I think it sheds light on why it's so important to get a personal consultation. And I think it's important, I think it's smarter to start the process early and, get in as soon as you kind of are thinking about something. I mean, consultations.
Because there's so many things we can help with.
That's right. That's right. And there's also a lot of things that people can do now where something bothers them and they think surgery is the only answer, and lo and behold, it's not.
Exactly. And just due diligence of knowing what's involved, having a plan. Now, maybe you act on that plan right away, or maybe you act on that plan in the future, but you've now got a plan and you kind of quit worrying about it. And that makes people feel better. There's a solution to my concerns.
Right. Now, when we talk about age limits, right? Both kind of younger patients and older patients, you kind of already talked about it, right? Like there's a chronological age and there's a physiological age, and that's very, very different.
And there's a maturity age.
There is, but there are 15-year-old girls with macromastia, really large breasts that come in that say they want a breast reduction surgery. How do you kind of help guide that patient, Evan?
Yeah, so I mean,
obviously comes in with their parents. They're a minor,
right? When I'm seeing young patients, I make it very specific in how I talk to them about the chances of your breast getting bigger. You're still going through puberty. You may have children, breastfeed. Your breasts are going to change throughout your life. Specifically, when you're having breast reduction when you're really young, there's a chance you could need to have another breast reduction.
Sure. And then what about with older patients? I mean, you kind of gave me a scenario where you had a patient that came in recently for, it was a facelift that was, an octogenarian. And, obviously an 80-year-old can be healthier than a 50-year-old. So, and it's a personalized thing. So I hate it when people say, I'll see somebody who's in consultation with another patient, and they're kind of the friend or the support network or the parent or something like that. And they're like, oh, I'm too old for that. Like, you don't ever do tummy tucks on 60-year-olds, do you? I'm like, of course. Like, what do you mean? Like, it's individualized, but there are no like age limits. There's a maturity limit. I would 100%
for the young
agree
patients,
with you. 100%.
There's a health criteria for everyone, but it becomes more in play in the older ones.
Right.
And I think there's a severity issue as well for the young patient who comes in for, say, breast reduction. And, if they're massive and life is difficult,
right,
then you can say, yes, the breastfeeding issues are there. And yes, there are scars through your dating years. And yes,
and for some of those patients, there's a diagnosis, juvenile breast hypertrophy.
Yeah, and,
it's a different...
the overall pros and cons favor doing it.
Totally.
Then you'll get the D-cup 15-year-old that they're awkward and they don't like them and they're getting teased about them. But, when they're 21, they're going to kind of love these or might.
Yeah.
And then you still have all the breastfeeding and the nipple sensation and the incisions. And those, I tend to say, I give them those considerations and then allow them to go, you mean I could wait? And I kind of support their decision either way. But I guess my own bias would be, these are pretty. You may not like them right now, but give you 5 years.
Well, and breasts are something that people can cover up, right?
Yeah.
And so what about the 13, 14-year-old?
With the ears or the nose?
Ears or nose?
Well, ears, I think, again, now you get into the maturity thing of, they can't revert to an 8-year-old when you do surgery and not following instructions and being destructive. But if their mom says, hey, they're here because they want to be here, I don't want them here, versus the mom that brings them in, the kid's going like,
why am I here?
I don't want to be here. Yeah. Well, one of those you can operate on, one of them you probably shouldn't. Yeah. But, ears, they can hide the ears. They can't hide the nose. They got to be done with puberty because their nose is still growing.
Well, in ears, you got to kind of wait until their ears have grown.
Got to get where they're going again, and it's kind of a puberty thing.
Right.
They're, as long as you got a mature kid and they want it, not just their parents want it.
Right.
I think it's a reasonable thing to do, and you get a feel for that. Evan, when you're talking to people, you can tell the kid that's squirrely and bouncing off the wall and inappropriate questions versus the one that comes in and looks you in the eye and goes, I don't like my ears. Yeah. And I'm tired of doing this with my hair and I'm getting bullied at school. And then that's kind of those are 3 green boxes checked.
Yeah. So we'll go down a list of kind of surgeries, and I think the answer is going to be the same for all of these. Obviously, the huge, backdrop for all of this is that all of these things are individualized. So when we talk about the right age to have a certain surgery, maybe just kind of give a pearl for something to consider about that surgery. Okay. So I'll go first with breast lift. All right. I think the right time to get a breast lift is when you don't like your breasts. and you think they're droopy and you don't think they're pretty. I think there's minimal downside to getting it. I think with the techniques that the three of us use, specifically kind of a superior pedicle technique that allows us to maintain blood flow, maintain sensation, maintain ability to lactate, all of those things that if you're 22 years old and you're sitting there and you're like, I hate my breasts, I always have. I mean, sometimes that can really affect sexual maturity in people and their confidence and just their general personality. So I say if something bothers you when it comes to breast lifts, if your breasts bother you, they're droopy, if you don't have upper pole fullness or cleavage like you want, there's no reason not to get it addressed. I don't care if you're 70 years old.
I'll give you a reason, and you're going to agree with me. You're 28,
okay.
You've been married for 3 years, and you're actively trying to get pregnant.
Well, yes, actively is totally different. Yeah, totally agree.
Yeah, and then you're just going to wait until, I would wait until they're done with their babies.
Right.
Because I'm thinking about cost to them.
Right. What if that person was 21 years old and said, I'm going to get married when I'm 28 and I want to have my first baby at 30?
I would say, how bad are the breasts?
These are people that
you and I might disagree on that.
Yeah, well, no, I just mean that, do you want to live 9 years with not so pretty breasts, or do you want to
be more fiscally conservative?
Yeah, you want to
do
it now, then after kids,
discussion.
if we need to do something, we can. All right, what about breast augmentation, Evan? What's a good pearl for breast augmentation?
I'm trying to think. I mean, as I was saying earlier, certain there are always special circumstances, right, that we come across. But I mean, if you're not happy with your breasts, we can help.
All right. And then what about, I'll take tummy tuck. Okay, tummy tuck. I think if somebody tells you, I'm definitely going to have more kids, then you're like, okay, then.
I would wait myself.
100% wait. Now, what about the patient who has kind of diastasis, but maybe had a C-section and they're not done having kids, but they've got this pooch, this lower abdominal pooch, and they're just like, I just hate myself in a bathing suit. I'm probably going to have kids in another couple years. I may have another one, but I'm rich as Croesus. Don't worry about money. Am I a good candidate to get my lower abdomen taken care of with a mini dermalipectomy or a mini tummy tuck and some liposuction? I want to look good for the next 5 years. We got a trip to Monaco coming up. What would you say?
What time can you be here in the morning?
Yeah. Right?
I think if they know the issues and they say...
You're burning no bridges. So long as you make, educated decisions about what we're doing and what your goals are, I think that I've seen plenty of patients who aren't necessarily done, but really don't like kind of maybe some excess skin or some stretch marks that they have in their lower abdomen or their C-section went awry. And so we devised a little name for that here called the poochectomy. It's not even like a mini tummy tuck. It's like literally just trying to unfurl that so that they don't look funny in yoga pants or any of those, first world problems, right? Like you don't look great in your yoga pants, but like those are real scenarios that I get. All right, how about a facelift? As far as the right age or timing to have a facelift, what's a pearl that you can give a patient?
Well, we talked about it a little bit. You got to have a real problem. And if you have a real problem and you're younger, I think it's fine to do it. It's a very low complications of easy surgery to recover from. The results are very nice. The results last longer because the tissues are better and they get you to enjoy it. It's a little bit like having a house that you put on the market and you spruce it up before you get on the market. Maybe you repaint it and recarpet and all that, and you get it really nice till the show and you go, dang, I like this house. I wish I'd have done this 5 years ago.
That's exactly right.
So doing that kind of facelift thing, when you come in and you actually have a real problem and it really bothers you and there are things we can make better, I'm all for doing it.
Right.
And then as long as they're a medical candidate and they're not a smoker and if the problem's to be fixed, you fix them and then it's
obviously,
green light.
I know you well, so I know that you are as honest and ethical of a surgeon as anyone's going to ever meet. What's the youngest and the oldest patient you've done a facelift on?
I think we did somebody, maybe one in her 30s.
Okay.
And she didn't have to have it, but it bugged her. And we kind of talked about it and convinced me that it really did bug her. And she really did have a problem. And it was early aging. Sure. And the oldest was 85. Yeah. And she was chronologically maybe 60. And she looked nice, but a year later, because her quality of skin wasn't that good, it didn't look as good as it did, right after surgery. And if you do that on a 60-year-old, it looks just as good, if not better, a year later.
Right.
And, a 60-year-old facelift, again, depending on the person, 13 years later, maybe only 30 or 40% would say, yeah, I need another facelift.
But what about, when somebody has a definable situation, right? Let's say they've got jowling. Let's say they have platysmal banding. Let's say they've got excess skin. Vectors are just kind of off. They could use it. You look at them and you'd be a great candidate. What about the patient that says, I'm 48 years old. I'm just going to wait and do it on my 55th birthday? Like, that's like
I'd say if you've got all those things, why would you wait?
Yeah.
Because you can enjoy it between now and then. And it's, the procedure is probably going to be very similar. And we've had some breakthroughs recently, but not, earth shattering. But it's just you get to enjoy it. And, well,
I can only imagine 7 more years of aging. I don't think the situation's going to improve either.
Right. Well, and then there's the strategy effect. Some people say, I want to get the best bang for my buck. Well, then you get to where you're looking awful and your grandkids look at the pictures and go, who's that, Granny? Well, that was Granny before a facelift.
That's right.
And then there's the other strategy of, I don't want anybody to know. I want to always look good. So if my friends just think I lost a few pounds or look younger, or not maybe even look like, just look good. But, I did it before I really needed it and I never really looked bad. That's a common strategy now. We're seeing many fewer patients walk in looking like they're 80 when they're 65.
Right. All right. Well, let's jump on. You could do this to every surgery. Obviously, it's you have to kind of tailor it to the patient. That's the importance of an individual consultation, which we would love to see you if you have any problems or any issues that you want to address, see any one of us. Let's talk a little bit about health and recovery. One question that came in, because we've talked about breast surgery and breastfeeding and that kind of stuff, and there's not really a best time of year to have plastic surgery. I would say if you're going to need supportive garments, you don't want to be wearing a full body compression garment in the middle of August. So I've had plenty of patients in the summer or late spring that come in for a consultation that say, I want a mommy makeover. When's a good time? And I'm like, why don't you wait till it gets a little cooler? Let's do like a September, October kind of thing for you. So I tell them that just because, we're at a point now in our practices where we're not like, next week. Like we just don't,
it's one of the things we do here. We look out for patients.
That's right. So answer this question. Does stress, like let's say somebody comes in and they're like, I'm taking care of my folks that have Alzheimer's. I'm separating from my spouse. My work is awful, but I want surgery right now. Like, how does stress, stressors, those types of things affect your ability to heal? And do you think that psychologically, when you got a lot going on, that's a good time to have cosmetic surgery? What do you think?
It's a warning sign to me, to be honest, because, I want to see my patients a lot after surgery because little minor issues after a surgery can get a lot worse if they're going down to Miami and not having any follow-up.
Right.
So I want to see them a lot. And if they're stressed, if they don't have the support network to heal, if I'm afraid that they're not going to listen to me, then I'm going to recommend waiting.
Yeah. I would say get all your ducks in a row before surgery. I think it's an important component. I think that the mind is extremely powerful, and I think that stress, hormones, those types of things can really affect your overall results. So I say the exact same thing. No one can live a stress-free life. Maybe Dr. Graper, but nobody else can live a stress-free life. He wanted a new flag for his sailing boat for Father's Day earlier this year. So that's great. That's a good life when that's what you're asking for. That's oh man. I would have gotten it for you.
I got 3 little flags for the putting green.
Oh no. So the putting green at his house, by the way, let's just go ahead and say that. So Allegiance Flag Company is a made in the USA flag company, right? Don't buy your freaking American flag from China, people. So Allegiance Flag Company is one that's made in the USA. That's where you go get it. And one of the drop down menus, because we got one for our house, says boat flags.
Oh, nice.
But maybe they meant like, aren't there like different signals for boats now that I'm thinking about it? Maybe they don't mean like an American flag for the boat. They're probably.
No, I bet they mean both flags.
All right, cool. Well,
because they're different sizes.
Allegiance, I'm going to buy you one. Tell me what size you want. That's my present too this year.
Awesome.
All right.
So you got, stress, we all deal with many stresses. And if you have one, it bugs you. If you got two, it's a problem. And three, and you add surgery on top of that, whether you can mentally deal with it, you're going to break down, whether you can follow instructions. It's just a bad time. Everything needs to be green lights all the way.
Perfect segue. Because a lot of our patients deal with their stressors by exercising, right? And so what do you tell the patient that comes in and says, I work out all the time. I think I'd probably murder my family if I didn't. And so, in fact, I ran 10 miles this morning before I came to this consultation at 9 o'clock. And I want my breasts lifted and I want my tummy taken care of. I want a mommy makeover because I work really hard, but nothing in the gym is going to make my breasts perky and nothing in the gym is going to put my muscles back together where God intended. So when can I go back to working out? It's different for every surgery, but what's a general kind of guideline for patients that you tell them? I can tell you from my standpoint, I tell patients for 2 weeks, you got to chill out. Nothing that gets your blood pressure or heart rate up, so nothing that makes you sweat. And the reasoning for that is because statistically, 95% of complications, bleeding complications and things like that are going to happen in the first 2 days, right? 4.5% of the remaining 5% are going to happen in the first 2 weeks. And it's increasing your blood pressure, right? When they're having surgery, our anesthetists have their blood pressure and all that just perfect, right? Awesome. And so then if they're 120/80 during surgery and they go start working out on day 3 because they're feeling great and their blood pressure gets up to 190, 200, they can blow through a blood vessel that we've cauterized or capped, and all of a sudden we got bruising and bleeding. So I say 2 weeks, chill out. At 2 weeks, you can start doing cardio, right? And at 6 weeks, your body is 60% healed. At 8 weeks, you're 80% healed. And then it takes the rest of that full year to get that final 20% of the strength of your incisions. So that's why it's 6 to 8 weeks. I say you've got no restrictions. I look at patients and I say, whatever your question is, can I fill in the blank? The answer is yes. Now, obviously go slow, right? Like, can I play tennis? Sure. The first thing that you do, does it need to be an overhead slam working on your serve? No, it does not. Can I do core exercises? Sure. Let's start off by doing a plank. Yeah, not a Rocky IV in Russia inverted.
Would you do a plank for a tummy tuck at 2 weeks?
No, 8 weeks at least.
I'd probably let him do it at 6, but 8's great too. I say that 6 to 8 just because, the difference between 60 and 80% is 20%. But, I say, do a knee plank first. Like, you don't need to be on your toes for that. And just listen to your body, wear your binder, all those types of things. But
so I will go a little different. My numbers are a little different than yours. But conceptually, for me, if they're that stressed out, there's a reason to get them back doing something. But if they've got a reasonable chance of hurting themselves, that workout is just not worth it.
Right.
And what I usually say is, if you're an NBA player and you get a cut on your face, well, you're playing that night, they're going to stitch you back up because you're making $50,000 a game.
Right.
Well, then it's worth it. But for the average person in Charlotte, if you're back in the gym a week or two early and then to put a hematoma infection at risk is not worth it. So I say your main priority for these 3 weeks, 6 weeks, whatever the particular procedure is, I think that's more important. And I tell them that. And if they don't do it, then they've heard the reasons. If they get a hematoma, they've got your phone number.
Yeah, right. Oh, well, all great advice. I think this was a great kind of intro into when's the right time for plastic surgery. Obviously, I think the take-home message is that it's individualized, but there are certain things depending upon what procedure and what's going on in your life, where you are with your weight, all of those things, where you are with your skincare, where you are with your overall kind of health. All of those things need to be optimized. This is elective surgery.
But it's the real deal.
It's the real.
It's very safe.
My
and
point
it's
is
very predictable.
that you don't have a ruptured, gallbladder that you have to rush in to have surgery.
But plastic surgery is very safe and relatively very simple compared to brain surgery or something like that. But when it goes sideways, it still can get pretty thick pretty quick. So it's important to be optimized and follow the instructions, and your chances of a good outcome are really good.
Speaking of, I thought it was kind of funny. One time, somebody was talking about how they thought it was pretty peculiar that everybody compared difficult things to brain surgery, right? Like, oh, it's not brain surgery, you know, something like that. And they're like, I wonder what brain surgeons compare it to. But if you have questions or topics you'd like us to cover, please visit ghsurgery.com. Click on the Doc Dudes from the homepage. There's a link to click to submit your questions and ideas. You can also listen to all of the Doc Dude episodes on our website, as well as Apple, Spotify, YouTube, or anywhere you listen to your favorite podcast. Follow us on Instagram and Facebook to find out when new episodes drop and other information about our practice. We hope you enjoyed episode 12, Your Time to Shine, When is the Right Time for Plastic Surgery. I am Garrett Harper, along with
Robert Graper
and
Evan Zug.
Thanks a lot, guys. Bye.